Hi everyone, welcome back to part 2 of our lash lift training manual. So today we're going to be talking about health and safety and about tools and supplies. Okay, so let's get started with hygiene and safety. So I'm going to be reading it from our manual and then I'm going to be commenting a little bit to each part. So I've got a hair tied back, no jewelry, nails must be short and tunic must be worn. So I want to talk about hair tied back because many people have got long hair, and if you do want to lean over your client, you don't want to tickle her with your long hair, okay? It's the same with the jewelry. If you've got some long jewelry and you need to lean over your client, you may tickle her with your earrings or with your necklace. She doesn't want to have, I don't know, some really chunky bracelet right next to her ear because she wants to relax. So try to wear as minimum jewelry as possible. The nails should be really short. It's just for the hygiene. Also, you are really close to her eyes, so you need to be very careful that you're not going to poke her in the eye with your nails. And tunic, it should be worn. It looks really presentable, but most of the time I'm wearing just normal clothes as well. So I think as long as you look really nice and presentable, that would be okay. But obviously if you do work in the salon, then you should be wearing tunic. Client consultation form must be filled out and signed. We were talking yesterday about client consultation form, so always double check after she passed the consultation form to you. So you don't just put it on the side, but you always double check after her, just in case if she ticked one of the contraindications. Explain the treatment to your client. So we were talking a little bit about it yesterday, that we need to communicate with her and we need to explain to her what is it all about and any aftercares as well. Make sure your client feels safe in your environment. So if she comes to you, if you've got your beauty room set up at home, or if she comes to your salon, you have to make sure that she does feel nice and safe and she doesn't think that, oh my god, once I'm gonna close my eyes, this wardrobe is gonna literally full on me. So yeah, just try to opt for quite low furniture, and it needs to look nice and presentable as well. If you do have any animals, I would recommend them to be maybe closed in the other room as she walks through the door and she goes into your beauty room, because not everyone likes animals. They have to know about it. If you do have animals, they need to know before they come to you that because they might be allergic to cat or dog fur. So I would highly recommend to tell them about it beforehand. If your client is wearing contact lenses, you have to ask her to remove them before you start the treatment. It's going to be for comfort as well, but also if the product enters the eye, it's just going to be so much easier to wash it out. Stop the treatment immediately if your client's eyes become irritated and you have to wash it thoroughly with the water. If the discomfort is still there, then she needs to go and seek medical help. If you are a smoker, try to remember to smoke at least 20 minutes before your client comes, because if they are non-smokers, they can smell it from your hands, skin, hair. So make sure you wash your hair thoroughly. You might put some kind of like deodorant or a little perfume on you, and make sure you use some chewing gum or some mints. Never use the same mascara brushes, gel pads, micro brushes on different clients because of cross-contamination. We're gonna clean our tools in barbicide, so it looks like that. Okay, I'm sure you've seen it somewhere with a hairdresser or in beauty salons, in nail salons. So you have to put your lash lift tool in there, and some people like to reuse their silicone shields as well. So if you do want to reuse your silicone shield, you need to wash it under the water and then put it into your barbicide, and like this is nicely clean and it's ready for the next client. Some people like to keep those silicone shield for the same client. So after they wash it, they put it inside into small little bag or a little like a pouch bag, and they write client's name on it so they know that this silicone shield is always for this client. You should always keep sterile saline solution next to you, just in case if the product does enter her eye, or if your client is complaining about some burning, then you can always, if it's the right eye, you can always ask her to lean her head to the left. You're gonna put a towel underneath and you're gonna squirt the whole sterile saline solution into her right eye from the outer corner, and whatever comes out through the inner corner, it would go directly on the towel instead of into the left eye. Now we say you should cover bottom lashes for your client, but this is completely optional. When I was trained, we weren't trained to be covering the bottom lashes, but I do find it easier if I cover the bottom lashes with the gel pad, because like this I'm saving myself time to be separating the bottom lashes from the top lashes. If you don't separate them properly, then there is a risk of you curling her bottom lashes upwards, which we don't want. Client's eyes must be closed the whole time. Ensure there is appropriate ventilation and lighting. Ventilation is really important because the product can be quite strong depending on the brand, but it is quite strong smell sometimes, so ventilation is really important. And make sure your client is really comfortable while the product is developing. Perming lotion, fixing lotion. The treatment is around 1 hour long, so we want her to be feeling nice and comfy. Don't forget to put nourishing lotion straight after if you are using the products what we are using. So that's got 3 steps: perming, fixing and nourishing lotion. I know there are some brands what they are using only 2 steps, but if you are using the 3-step one, make sure that you do put nourishing lotion, because this is really important to put straight after those 2 lotions. The first 2 lotions will dry a little bit the lash, so nourishing lotion will give it all those vitamins what your lash needs straight after the treatment. And now we can move to tools and supplies. If you are doing mobile treatment and your client would like you to come and see her in her house, make sure you don't spread your equipments all around, just in case if she does have some children or animals and they just help themselves to the product and they start chewing on them, then your insurance won't cover you for that. It's your responsibility to keep everything safe. So whatever you use, you close the lid, and then you're gonna put it into your kit and you're gonna close the kit as well. Okay, so just keep it nice and tidy around you. So what we're gonna need? We're gonna need antibacterial gel. I always wash my hands first and then I'm using antibacterial gel. Then we're gonna use primer or oil-free makeup remover. So as you know, our natural lashes has got natural oils in them, and for product to work better and to have better results, we have to get rid of those natural oils. So we're gonna be using either primer what you can buy from any suppliers, or you can be using oil-free makeup remover, because oil is a blockage. So just nicely clean the lashes before you start, and then make sure that the lashes are nice and dry, and then you can start the treatment. Micropore tape. You can buy micropore tape in any chemist. Now, there are a few different uses to micropore tape. Some people are using it to hold the bottom lashes down. If you do that, don't place directly micropore tape to the skin without getting rid of the stickiness. The way you're gonna get rid of the stickiness is you're gonna ask your client for her hand. You're gonna apply micropore tape on her hand, and then you're gonna place it under her eye. The reason why we do that is because the tape is very sticky, as I mentioned already, and that part of skin is very sensitive. So sometimes she can have little red area if you don't do that. Also, asking for her hand would be more hygienic to if you are using it on your own hand, because our top layer is dead skin and we don't want our dead skin under her eyes. So always get rid of the stickiness from on her hands. So yeah, you can use it in a kind of like X shape. So you place one sticky tape here, another sticky tape here, and like this you cover bottom lashes. Another people are using Micropore Tape to hold hooded eyelid slightly up. So they're gonna place the Micropore Tape here, and it's gonna be quite long. So they're just gonna pull the eyelid slightly higher and stick it on the forehead. So you would probably need 2 long strips to hold here and here. And that helps you to see better where is your client's lash line. This is really important because we're gonna get to it in the next video, I think. We have to place the silicone shield as close to the lash line as you possibly can. Like this you can achieve fantastic results. So for you to see better her lash line, some people helping themselves to actually by sticking the Micropore Tape on their eyelid and just like lifting it up gently. Make sure you don't lift it up too high because you don't want her eye to be constantly open while you're doing the treatment. And the last trick I've seen for Micropore Tape was that the people are actually placing Micropore Tape on top of their eyelid because they say that the silicone shield is actually sticking better to the tape instead of the eyelid. So whatever works for you, do it your way. Then you're gonna need collagen pads or gel pads. I am a big fan of gel pads instead of Micropore Tape, so I'm holding bottom lashes with the gel pads instead of the Micropore Tape. We are using mascara brushes to brush your lashes properly, to separate them because they have to be evenly separated when we stick them onto the silicone shield. We're gonna need silicone shields. You can use small, medium, large. I know there are some companies but they are doing medium 1, medium 2. Everyone's got different sizing. So I showed you in a video, in yesterday's video, how to roughly measure what shield size will you need for your client. Adhesive, it's specialized for lash lifts only. Don't use the adhesive what you would use for eyelash extensions because this is completely different adhesive. Yeah, this has to be water-based adhesive with your lash lift. Permin lotion, fixing lotion, nourishing lotion, permin lotion. It curls the lashes into the desired look. Fixing lotion, it's going to keep those lashes in this desired look. And the last one, we're using nourishing lotion. I know there are, like I said, some companies that are using only 2 lotions. With this one, what we're using, it's a 3 steps. So the nourishing lotion, it gives you all those vitamins your lashes need. Micro brushes, we're going to apply product with the micro brushes onto her lashes. Make sure the product is not going to touch her skin. This is really important. That's why we're using really fine micro brushes, so we can be very precise what we are doing. You're going to cover all her lashes, literally from the inner corner all the way up to the outer corner. Some people cover only like 1/3 of the lash, some people cover half of the lash, some people cover the full length of the lashes. So it just all depends of the brand, what you're using, what kind of silicone shields you are using as well, because sometimes if the lashes are slightly longer, you don't want to cover the whole length of the lash because it's going to look like the lashes are over curled, so they're just going to bend almost like, you know, backwards, which we don't want that. Cotton buds and cotton pads. So with cotton buds and cotton pads, we're going to be removing the product. Water to clean the lashes afterwards. Timer, this is really important. We have to stick to the time. If you don't stick to the time, we're going to over process the lashes and they're going to look burned. And if you do mobile services, then we've got little gadget. They are called Magnifying Glasses, and they were really helpful for me when I was doing mobile services. It was winter, 4 o'clock in the afternoon. I could hardly see in some of the houses what I'm doing because they had like one little Himalayan lamp in a corner. So I would normally use the magnifying glasses with me. Of course, if you are working from your home, if you've got salons, the best would be the floor lamp, the big lamp. But magnifying glasses were fantastic while I was doing mobile treatment. You can ask your client if she would like her lashes tinted as well. If she does want her lashes tinted, then you need to be doing steps following. Perming lotion, fixing lotion, tinting and nourishing lotion. If you do forget to tint her lashes during the treatment, you can tint her lashes the next day, so you wait at least 24 hours because the nourishing lotion at the end is really important. So don't try to tint her lashes straight after. And also, if she does come to you in the same day, for example in the afternoon, and she says that she's had her lashes tinted in the morning, don't try to do the lash lift in the same day. So always wait for tinting at least 24 hours before, or you do tinting 24 hours after the treatment. Or if you do remember, or if she does want it during your lash lift, then you do perming, fixing, tinting and nourishing like I mentioned already.